Hi everyone. My topic of discussion is ultrasonographic grading of varicocele and its correlation with semen parameters, a cross-sectional observational study. Varicocele is one of the most frequently encountered correctable cause of male infertility, characterized by abnormal dilatation and tortuosity of pampliform venous plexus or spermatic cord, out of which 15 to 20% of general male population suffer with it, of which 35 to 40% of male present with infertility. The pathophysiology being increased scrotal temperature, testicular hypoxia due to venous stasis, oxidative stress, reflex of adrenal and renal metabolite, and hormonal dysfunction. Traditionally, varicocele diagnosis and grading was based on physical examination using Duplin and Ambler classification based on palpability and visibility. Then emerged color Doppler ultrasound, which became imaging modality of choice for evaluation of varicocele due to its non-invasive nature, wide availability, and high diagnostic accuracy. And then it was created and stat test key classification came into picture. The aim of the study is to evaluate the correlation between ultrasonographic grading of varicocele and its semen parameters in men undergoing scrotal ultrasonography. Objective being to assess the association between color Doppler ultrasonography based varicocele grades and then semen analysis parameters including sperm concentration, motility, and morphology. The study design being cross-sectional observation study conducted between Department of Radiodiagnosis and Urology, and the study was performed over a definitive period of time with consent being taken. After calculating the sample size, it came out to be 40. The inclusion criteria were male patient referred for scrotal ultrasound with suspected or clinical diagnosed varicocele, patient evaluated for infertility or abnormal semen parameters, age group typically from 18 to 45, willing to provide semen sample and consent for participation. Exclusion criteria were prior varicocele surgery, history of orchitis, testicular torsion, significant scrotal trauma or testicular malignancies, known endocrine disorders affecting spermatogenesis, patient undergoing chemo and radiotherapy, patient having genitourinary infection, and obstructive ozoospermia or known genetic cause of infertility. On ultrasound, using high frequency linear transducer, both testes were evaluated in supine and standing position, and venous reflex was assessed at rest and during Valsalva maneuver using color Doppler. Then testicular dimension were measured and testicular volume were calculated using standard formula. Semen analysis, for which sample was collected from patient and subjected for laboratory evaluation. In semen analysis, we got the information of semen volume, sperm concentration, motility, and morphology, which being dependent variable. Independent variable is ultrasonographic grading of varicocele. And statistic analysis being done. And these are the few pictures from the study. The first one showing scrotal ultrasound with dilated vas difference with associated spermatocele and varicocele. And picture 2 depicting color Doppler ultrasound on the patient showing left pampliform plexus with dilated veins with spontaneous venous reflex noted even during normal respiration consistent with left-sided varicocele. And then this picture showing grayscale ultrasonography demonstrating multiple dilated serpentious vein of left pampliform plexus adjacent to left testis consisted with left-sided varicocele. The results which were obtained and the first table shows comparison of semen parameters across ultrasonographic and varicocele grade, which depict that despite the trend towards lower semen parameters in higher grade ultrasound grades, the difference were not significantly sufficient, indicating varicocele grade alone does not or do not rely predicting the semen quality. The second table is correlation between ultrasonographic grading and semen parameters, which shows increased ultrasonic grade showed a negative trend of semen quality. However, these associations were not statistically significant, supporting limited predictive value of grading alone. Table 3 shows comparison of semen parameters based on testicular volume, which showed that testicular volume is a strong predictor of impaired spermatogenesis than ultrasonographic varicocele grading. Table 4 shows correlation of testicular volume with semen parameters, which showed total testicular volume showed a moderate positive correlation with sperm concentration, motility, morphology of which was significantly sufficient, reinforcing its role as a functional indicator of testicular health. And the discussion was analysis of semen parameters across different ultrasonographic grade demonstrate that higher grade tends to be associated with low sperm concentration, motility, and normal morphology. However, these differences were not statistically significant. On contrast, testicular volume demonstrate a significant association with semen parameters. Reduced total testicular volume is associated with significant low sperm concentration, decreased progressive motility, and poor sperm morphology. The conclusion was ultrasonographic grading of varicocele, while valuable for diagnosis and anatomical classification, shows limited utility in predicting semen parameters abnormality when used in isolation. Increasing varicocele grade demonstrate only a non-significant trend towards poor semen quality, highlighting the weak functional correlation of grading severity. In contrast, total testicular volume exhibit a significant association with sperm concentration, motility, morphology, reinforcing its role in predictor of spermatogenic function. These findings support the use of comprehensive evaluation strategy that combines color Doppler ultrasound, testicular volume measurement, and semen analysis for clinical decision making. And these were the reference articles. Thank you so much. Happy Christmas. Happy New Year.